Social and economic measures of development. These measures will be unequal. For example, GNI might just be a very low spread, so it won't be spread across the country. GNI, gross national income, and there's GNI per capita, which means total income from the country and abroad, divided by number of people. And there are huge global variations. So, for example, an earning per year, GNI per capita, in Norway is $93,820, whereas in Somalia it's $150, and most of the poorest countries are in Africa. Limitations are average figures, can be misleading. Very few wealthy people in the country can distort figures. Poor countries, many work in farming or the informal sector where their income is not taken into account by official GNI records. Data about income is sensitive and people may not always be honest. Birth rate, number of live births per 1,000 of the population. High birth rates are associated with poor countries where child survival rates are low due to poor healthcare, lack of safe water, poor diet, sanitation. Large families ensure a decent income for the family and provide support for aging parents. The highest birth rates exceed 40 per 1,000 in Afghanistan is 44 per 1,000. The lowest rates being around 10 per 1,000, so in Finland it's 11 per 1,000. Birth rates are a good measure of economic and social development. Some countries, for example Cuba, 10 per 1,000, have low birth rate even though people are relatively poor. It's due to socialist political decisions, focus investment in healthcare over other sectors. Birth control policies can distort as a measure of overall development, so in China it's 12 per 1,000. Death rate, number of deaths per 1,000 population. Death rates are relatively low throughout much of the world due to basic improvements in healthcare. Highest rates are in Africa and the Middle East, so 18 per 1,000. Death rates can be moderately high in HICs due to aging population, so Japan, 9.9 per 1,000. Lowest death rates are in NEEs, where people are living longer, but yet to die of old age. Death rates are a poor measure of development. They can be high in some LICs due to poverty, and HICs where there are many more elderly people per 1,000. Infant mortality, number of deaths of children aged less than 1 year old per 1,000 of the population. Figures vary enormously, with the highest values in African countries, so 96 per 1,000 in Angola, and lowest in HICs, so Germany is 3 per 1,000. Good measure of development reflects the level of healthcare and service provision in the country. The poorest countries, not all deaths of children are reported, especially in remote areas. The true rates may be even higher. Life expectancy, the average number of years a person can be expected to live at birth. HIC's life expectancy can be over 80 years. NE's life expectancy can be between 65 and 70. LIC's life expectancy is typically in the 50s range, so Nigeria is 53. A good measure reflects healthcare and service provision. Data not always reliable, especially in LICs, can be slightly misleading in countries with high rates of infant mortality. People surviving infancy may live longer than expected thereafter. People per doctor, doctors per 1,000 population, and literacy rates, percentage of people with basic reading and writing skills. So huge variations exist between LICs and HICs. 1 doctor per 350 in the UK, and in Afghanistan it's 1 doctor per 5,000 people. HICs have hit literacy rates of 99%, LICs is below 50%, so Afghanistan is 38%. People are seeking help and advice by using mobile phones. This is becoming popular in India. not including data of doctors. A good indicator of development, though it can be hard to measure, especially in LICs due to lack of monitoring of literacy rates. War zones and squatter settlements are difficult areas to measure literacy rates. Access to safe water. As a percentage, in EU countries, all people should have access to safe water by law. Access in many LICs is poor, so Angola is 34%. Data collection in LICs is not like to be accurate, as official figures and may underestimate the problem. People may technically have access to high cost, but high cost may force them to use water that is not safe. Pipe leaks and natural disasters can deprive people of piped water. HDI, so composite measure of data on income, life expectancy and education, calculate an index from 0 to 1. Highest HDI are in HIC, so Norway is 0.944, and lowest are in African LICs, so Niger it's 0.348. Developed by the UN, most commonly used as a measure of development, as it's a better spread of data. Uneven development, so physical causes, so weather and climate, extreme conditions such as heavy rainfall, droughts, extreme heat or cold, and vulnerability to tropical cyclones, so natural disasters too, can impact economic development. Central and Western Africa experience limited and unreliable rainfall, and live in a hostile environment. Philippines and Caribbean are tropical storms. For 2016, over 1,000 people in Haiti were killed by Hurricane Matthew, and 230,000 people killed by an earthquake. Relief, mountainous regions such as Nepal, remote and poor infrastructure, subject to extreme weather conditions. Landlocked countries that are coastline lack the benefits of sea trade, which can limit access to other parts of the world. 8 out of 15 lowest ranking countries, according to HDI, are landlocked. Tropical environments, hot and wet, prone to pests and diseases, spread rapidly. Malaria, for example, by mosquitoes, and cholera by water, can devastate communities and reduce people's ability to work. Water shortages, shortages of water, essential for life and development. Many parts of the world, like Africa and the Middle East, don't have this. Economic causes, poverty, lack of money in the household, slows development.